Hello everyone. Namaste. I'm Dr. Rajeshwari Rapata speaking from Sai Sanjeevani Homeopathic Online Clinic. So as I'm speaking on common children's ailments, one of them is bedwetting and or it's also called as enuresis. Now it is common in children to bedwet till the age of 3 to 4 years. But it can extend beyond 5 to 7 years, then it becomes concerning. The parents are more concerned about it, may get worried, and then they rush to the doctors for this. Yes, it needs medical attention. There can be several reasons for bedwetting or enuresis. It can be because of improper toilet training. That's the most common reason. Children usually learn to control their bladder between the ages of 2 to 4 years. Later, gradually, they learn to adapt to their bodies and it is on their own pace. So, frequent recurring bedwetting, it can be a concerning one. And that's when medical attention is needed. And it can be because of some underlying medical conditions too. And that's what the doctor diagnoses when the parents come to the doctor along with the child. So it can be because of urinary tract infections. That's also one of the common reason. It can be because of constipation. It can be because of the nervous problems. It can be because of spina bifida. Diabetes also in children, juvenile diabetes. It can be because of blockage in the urinary tract. There can be obstructive sleep apnea, and it can also be in the children suffering from the autism spectrum disorders. So there are several causes and the doctor does the diagnosis and you get the treatment. Now there are many homeopathic medicines for bedwetting, and these medicines work so well in treating and curing the case. So one of the common medicine which we usually give is belladonna. This is especially indicated in children who have fever. And in this fever, the child sleeps in a stuporous condition and there is delirium in the sleep. And in this delirium, the child bedwets, does the urination on the bed. The child doesn't feel the urge to urinate. And that's how he doesn't wake up and urinates in the bed itself. So delirium and being sensitive to the change of weather is one of the indication where we give belladonna. Another medicine is causticum. Now causticum is especially indicated in bladder problems where there is no control over the bladder. There is weakness of the sphincter and the child especially urinates in the first few hours of sleep. And the problem generally is seen in dry, clear weather. We usually find that whenever it's winters or rainy season, it becomes more common for the children to bedwet. But here you'll find the causticum. In causticum, there is the child gets the aggravation of this problem in clear weather and dry weather. So generally the problem is due to bladder and sphincter problems. One of the almost you can say specific medicine which we give is equisetum, and this is again a common medicine and is specific for the bedwetting or enuresis. And here the child dreams, he gets horrific dreams, wakes up horrified with nightmares, and already he has urinated in the bed. That's what the parents complain, and it is used as a more specific in mother tincture forms and also in the lower potencies. Another medicine which we find very useful in bedwetting is equisetum, and equisetum is given in 12 potency, 30 potency depending on the individual. And here you'll find that the urine is offensive. It has a much odor, and the child dreams of urinating and passes the urine involuntarily in bed, and that's where the criosetum is indicated. One more common medicine which we give, especially when there is the indication of worms. So it is prescribed when bedwetting is due to the irritation of pinworms, and because of which the child urinates in the bed. So there are other medicines also which we give in the bedwetting, like sepia, the calcarea carb, cinna, and several other medicines depending on the symptoms, indications, and individualization. So many parents think that it is that the laziness of the child causes this urination, and they punish the child, shout at the child, but it is not so. You need to go to a doctor and get it diagnosed and get it treated as early as possible, because this bedwetting, if it is not treated at the right time and the right cause is not found, then it can go into adult age also. So there are some patients who are adults and do the bedwetting. So right treatment at the right age is very necessary. So homeopathic medicines work very well. I have treated successfully many cases of children having this bedwetting, and it's important to consult a homeopathic doctor and get your treatment done. So if you want to consult me, you can just consult on the website given in the bio. Go to the link and book an appointment there. And if you like my videos, do follow me on Instagram, also on the YouTube. And this is for today. If you have any comments, any inquiries, you can put it in the comments there. And be there, stay healthy, stay safe, and signing off at present, and see you again in another video. Bye bye.